Hi Jane, thanks for taking the time to speak with me today. Earlier this year, you wrote an article for our website exploring various aspects of the NHS 10-year health plan and the desired move to increase the use of digital services. You compared the shift from analogue to digital in the NHS to the shift from CDs to streaming in the music industry. Can you give your view on this?
Yeah, absolutely. And thank you so much for inviting me to come speak with you. I think whenever there's a shift in the technological area, there's opportunities that we can all benefit from. I mean, just really think about how many of us have made better use of our music just simply by having it streamed, whether it's in the gym or whether it's satisfying that earworm that's like gnawing at your soul, which we weren't able to do before. Now, think about how much that is magnified when we take those kind of advances somewhere like the NHS. So, in a really similar way, moving from analog to digital in the NHS creates a raft of benefits that maybe we didn't even think about years ago. That could be anything from, I don't know, patients being able to access information about their surgery right from their bedside online, being able to order food, being able to speak to a loved one, being able to access translation services from the bedside to improve equality and also improve outcomes. Ultimately, the 10-year plan focuses on patient empowerment, when you think about it. And so, how better to improve patient empowerment than use technology to drive changes through what's coming up next?
And how much of the infotainment structure that's currently in trusts can be reused in this switch to digital, and how much needs to be completely replaced?
Sure. Assuming that trusts already have our infrastructure in place, we're able to reuse a considerable amount of this, upgrading their systems and greatly reducing costs to them to take advantage of these changes. And in fact, we're looking to support even an incentive to support trusts in the switchover. Part of the reason for doing that is in our early discussions with trusts, and I really believe in strong partnerships, we completely understand the environments that they're working in. And so we want to really support them in enabling the transition. So, look, from our side, absolutely, we would be looking to leverage the existing infrastructure, which ultimately drives down costs.
And what are the other big barriers in moving from analog to digital in NHS trusts, and how can they be overcome?
From my point of view, whenever I think about these big barriers, the key thing to address is that although the NHS can look really monolithic, the environment for each trust is so unique. So, for example, some trusts are super well set up with an excellent infrastructure, including Wi-Fi. Others are like facing really expensive upgrades, wholesale installations that can cost into the millions. So, for me, the barriers really come down to people. I spent my entire career working in industry, but with a strong partnership in NHS trusts. And the key to it is really understanding what are the challenges that are unique for that trust so that we can work with them to solve that. So that's what we really want to be doing in Spark. If we can understand the challenges of each trust, we can then work closely together with them to create solutions that address their issues, not only technical solutions, but also cost and adoption hurdles as well.
And speaking about the 10-year health plan, how realistic do you think it is? And at the end of the decade, how much progress do you think there will have been in the area which you work?
And I strongly believe that the 10-year health plan can be achieved, but only if government, the NHS, and industry work in partnership. The plan itself emphasizes patient empowerment, as I mentioned, technology adoption, and partnerships across sectors to deliver universal sustainable care. It aims to reduce waiting times, improve outcomes, restore public confidence. And having now worked with our flagship sites like Stockport, we can really measure benefits of what we're doing and show that this is possible. Last week, we announced that CardMedic, which is an amazing service that supports languages and translation services, is now available on our Fusion devices right across multiple wards across the hospital. So, what does that mean in terms of achieving outcomes? It means patients who may not have English as their first language, they suffer from a hearing impairment, otherwise struggle to communicate, can now access devices at their bedside to both reach out to clinical teams, but also understand what's being said to them. That drives patient empowerment, it improves care, And I can't emphasize enough what a challenge this has been to the NHS, both in terms of driving the better outcomes, but also a quality of care. And as an aside, it's a service that also will show kind of monetary savings, which can then be deployed elsewhere. So going back to your question on the 10-year health plan, we can show demonstrably that we can make huge headroads into it, like from today. It's really about that partnership and working together to get it done.
And with the infrastructure becoming more digital, what challenges will trust face in keeping this new digital infrastructure up to date over the years?
Look, I think that this has been a challenge for trusts, and traditionally we've looked at different models in terms of how do we support trusts in keeping infrastructure up to date. In the world that we live in now, moving analog to digital infrastructure is going to be absolutely key for trusts. For me, again, it's about that partnership piece. How do we partner with the trusts to create models, whether it's software as a service or infrastructure as a service, to make sure that their infrastructure doesn't get old? It makes such a big difference. And I can tell you endless stories of going into trusts and seeing how technology can be better driven and better empowered when you have a solid infrastructure base to what we're trying to do. And I think that will ring true across most trusts.
And what new developments do you expect to see over this 10 years?
There's so many exciting developments at the moment. And I know many people are speaking of like AI as a development. I don't see it quite that way. To me, AI is a tool which allows us to go faster at solving problems. So with that in mind, to me, as a solution provider and AI in our toolbox, just as a tool, we're becoming faster at solving problems for trusts. The key element for me is understanding the trust and what they're facing into so that we can then fix those problems. So if we take an example, if we understand what's taking time for a trust to provide, we can then solve it. One of the things I've been talking to trusts a lot about at the moment is the time that they take to provide patients information, both around what their treatment is going to be, but also around kind of treatment outcomes, how to care for a wound when they get home, for example, things like that. If we understand that's where trusts are spending a lot of time, and it has huge implications for everything from patient outcomes to things like insurance premiums, gosh, that's something we can easily support with. And in fact, we can quite quickly and rapidly deploy solutions which are customizable by ward using the latest developments like AI to make that go even faster.
And a final question, how do we make sure that digital tools improve the working lives of staff and enhance rather than detract from the human side of care?
This for me is a question that's really close to my heart. One of the key things that I've learned working with the NHS for such a long period of time is that most people don't join the NHS. They don't join a medical profession or a clinical profession because they are passionate about IT. They join it because typically they're passionate about providing care. For me, as someone who provides digital tools, it's that bridge that we need to work with the clinical teams in a partnership way, not just as a one-off, here's your solution, and then we walk out the door, almost in an ongoing way to understand what's working and what's not working so that the IT and the digital tools truly support clinicians and patients rather than clinicians and patients having to work around the digital solutions. And gosh, I've seen that more times than I care to say. And it is the complete opposite of what we're looking to achieve in Spark.
Well, that was the final question. Thank you very much for your time. Is there anything else you'd like to add?
No, but thank you so much for spending time, and it's always a great pleasure just being able to talk these things through. So thank you very much.
Thanks very much.